after losing all the weight, it can still be pretty discouraging because your body may not entirely reflect all of that hard work, and that's where body lifts come in. Here to tell us a lot more about that, we have Dr. Bridges with Bridges to Beauty. He's going to be answering all of your questions about body lifts for the next half hour. We really want to encourage you to ask all the questions on your mind. So if you're online, just fill out the information on your screen and submit it. Or as always, you can give us a phone call. That number to call, 318-219-4569. We're going to be taking all of your questions until 12:30. So talk to me, doctor. What kind of lifts can you do for people?
Well, you know, most of the lifts are done after massive weight loss. Okay, and the kind of the sequence or order of doing body lifts or restoring the body back to better proportions is again removing the extra skin. The abdomen is probably the biggest area. Okay, from pregnancies to weight loss, whatever things are, weight gain, weight loss. That's where you take basically skin from the abdomen and sometimes all the way around. I mean, we have some graphics of that, befores and afters. Other places to lift are arms. You know, basically the ones with almost a little bat wing type of, at least that's what it's called, or if they wave, it just waves.
It waves back at you.
Yeah. That's another place where you can do lifts. Okay. And then finally the leg lifts. And then, you know, usually with the body lifts, if you go around the back, you're doing a butt lift too, a buttocks lift. You know, you're trying to preserve some volume back there, but you're also trying to get better projection.
Can you do all of those, or is that just too much for one person?
It's too much for one person at one time.
Okay.
You can do the body lift portion, I mean the one around the abdomen and the back, you know, at that time. And generally when I do the body lifts and go around the back, I automatically just do the buttocks lift because you know, you don't want to throw anything away that could be valuable. The arm lifts, they're usually done separately, and the leg lifts especially are done separately. The reason being, you don't want to tie up the arms and legs at the same time because people can't get around very well. Again, they're all good operations. You know, the sacrifice that you make for the contour, for the great contour, are the incision sites. Like I say, the incision site around the abdomen really doesn't matter because it's always covered up. The ones on the arm, they can be reasonably visible. You know, they're usually pink for about a year before they finally fade in. The ones on the leg, again, they're covered up, so it's not as big an issue.
Okay, we've got two callers on the line, so let's go ahead with the first one. Sharva, you're on the line. What's your question?
Yes, hi. I'm scheduled to have some bariatric surgery done, and I have already lost 100 pounds, and right now my arms appear to be jiggly just from the fat pockets. You can see the cellulite a little bit in them, but I consume a lot of water to try to flush the body, and I'm scheduled to have, as I acknowledge, the bariatric surgery because I need some back surgery done, and they want me to lose another 200 pounds because of my height. I'm 6 feet tall.
Sure. And
I was wondering, are you connected with the bariatric surgeon, or is this something that is on a plastic surgery level?
It's more of on a plastic surgery level. I'm referred bariatric patients after they have lost weight, and you really want to be down to where you're going to go, because if you do all that skin tightening, even though I overcorrect, you know, on all of it because I just feel that's needed to do, and then you turn around and lose some more weight, you're deflating a balloon that doesn't have a great deal of elasticity to it. Okay, I've never seen you know, those issues return, but you know, logic being, you know, if you tighten up skin, then lose weight afterwards, it has no elasticity, it doesn't snap back like you would intend it to.
Okay. Is this a special insurance that you have to have, or is it cash? How do you work with your payment plan? Yeah,
it's usually cash, but you know, people will get that care credit. It's very, very good. Nice thing about it, if you pay it off, I think within 18 months or 24 months, I forget which one it was, there's no interest tagged on. I don't think you can beat that.
Okay, so are you requesting for that to be paid first, or is it a process along with every time you because I'm gathering that you're going to be doing the whole body. So, because right now my stomach is hanging,
right,
and I've had a partial surgery that when they cut into my stomach, they use staples, and they did what they could to keep it at in the center where it's supposed to be, but that area is dead now. So there's no life there.
It's just,
and like I said, I have to finish losing a certain amount of weight. And I was wondering if once you do it, because you were talking when I came in that you do it in sections. So is that included in everything?
Generally,
included in everything.
Right. Generally, most people will pay, by the surgery they're about to have. Okay. And, that's paid, kind of up front, both for me as well as the surgery centers. The reason you can't do those all at one time is, remember, the body doesn't look at fat or skin as it looks at it as important as other tissues. And everything I do, or any surgeon does, your bariatric surgeon, myself, as far as your body's concerned, it's a calculated trauma.
Okay.
And the body doesn't look at trauma based upon the type of tissues. Okay, it looks at trauma based upon the volume of tissues that's beat up on. Okay.
Okay.
When you do a body lift, it's a big volume. Okay. And there's not much blood loss to it, but still, the body, all it sees is an area that's been beat upon, and it has to use its energies to heal it up. And so if you did total body lift, leg lift, arm lift, it's a big amount of volume. And I don't want to end up on 20 or 48 hours and things, because we did too much. Again, you have to be reasonable about any type of surgeries you do, because that's what they are. I mean, your body won't know if you got hit by a truck or had an operation. It doesn't care. Its job is just to heal it up. It takes some energy to do that. When it comes to body lift stuff, there's some fluid shifts, so you have to keep up with your fluids. You just want to make it safe. It has to be safe.
Okay, that's important to me as well.
Yes.
So do you recommend any type of special diet to increase the cells for healing, or for the energy, like you said, that it's going to take to have the surgery? Would you suggest anything? Because like now I'm working on portion size to be able to, along with a very healthy diet, I'm working on portion size to be able to deal with the recess of food that I will be taking in for the bariatric surgery.
Right.
So is there anything that you recommend to, like, starting the healing process, like say for taking vitamin E, aloe vera, anything in that area for, like, to get the cells, the self-healing from the inside?
Yes, I mean, when it comes to surgeries, I think, doing your vitamins are real important, except for vitamin E. You want to stop it about a week before. It tends to increase the bleeding, and bruising. Vitamin C is real important. I'm a big believer in lots of protein. Because as your body sees this trauma, it rebuilds things with protein, and so you want to stay up on that. What type of bariatric surgery are you having? The
banana sleeve.
Okay.
Yeah, I don't want the what do you call it?
The bypass?
The one where they reroute the organs.
Yes. Yeah.
I wanted for my stomach to be reduced to get me back into, like I said, learning portion size.
Right.
And starting me back healthy, because I was told that that patients have had this surgery on more than one time. And I used to be a physical fitness instructor, believe it or not, and I don't want to go through that process, and I'm trying to learn how to discipline myself. And what we found out is that as I was growing through life, I never had the Richter scale that was inside of my organs never registered when I was full.
Correct.
So that's going to teach me that system again, along with a healthier nutrition plan. Like I said, I've already lost 100 pounds just on changing my diet, my portion size, getting better at nutrition. But the problem that I'm having is that I have 6 discs. I broke my back, and I have 6 discs sticking out of my back where I can't do the exercise.
Right.
So in order to lose the weight, progressively with not having the skin hanging and so forth. So in order for me to have a successful surgery on the disc, I need to lose the weight. And this is the only program that we have found that will be successful in the amount of time and the cost for me to lose the weight. And so I know before I had, my doctor was concerned because I was losing weight rapidly, and my arm started recessing, and then it was this layer of skin. So he did tell me that you're probably going to have this pull. And I'm looking at the way that my body is starting to, it's getting smaller, but it's hanging. Everything is hanging. So I'm figuring that that's the skin because I'm losing the fat, and I'm building it up on protein. So I was concerned for the after procedure.
Yeah, the proteins is real big. People that have a true bypass where they reroute the organs, or at least the intestines, they would need to have some blood work to determine their albumin levels. With that particular surgery, your absorption is not quite as good of all your nutrients, and whereas yours, it'll be fine.
Okay.
It's just that once it get rerouted and things, their albumin levels can go down, and that's a pretty good indicator of how they're going to heal. Low albumin levels don't heal quite as well as people with normal albumin levels.
All right, Sharva, thank you so much for your phone call. We appreciate you calling in. We really wanted to get to some of these pictures that you were talking about, Doctor, because we really want to show everybody at home kind of the before and after. So if we can go ahead and put up that first picture. Okay, describe what we're seeing here.
Well, of course, the one on the left, at least for me and things, is the before. And this lady had actually lost a bunch of weight on her own. Okay. And she wanted basically that, what's called the pannus, the extra skin that's around there that would cause irritation, and it wouldn't be all that comfortable or smell well in the summer times when it's hot and sweaty. Okay. So she wanted all that taken off. Hers also tightened up her muscles, kind of like a tummy tuck, but I went all the way around on her to get the best overall contours.
Yeah, you can really see that it's kind of hanging down over her underwear on the left-hand side, but then on the right, it's flat. Okay, I think we have some side images of her as well to get another angle for you of the before and after. Okay, yeah, there you go. That's a big difference, Doctor. Is this what is typical for people, or is this kind of one of those?
Well, it's fairly typical. I mean, I do some liposuction with these, which some people don't. I think you can, not push the envelope per se, but I think you can do better by doing some liposuction with it. That's a very good result. Everybody's body habitus is a little bit different. In her, you can tell as far as her shape, she had more of that hourglass, where some people have, go from the ribs just straight down to a small pelvis and things. So they won't have quite the curve, but they certainly will get all the extra skin and things that are bothersome off of her. Off of them.
Yeah. Okay, well, as our last caller was talking about, she was saying that she's lost 100 pounds, so she's ready to get this done now, but she still has further to go. Yes. So your recommendation is for people who might be like that out there, same way as she is, to wait until you've reached where you want to get. Explain why. Well,
the reason being is, let's say that basically she's down 100 pounds. We go ahead and do the operation. I pull real hard, we get all the skin off, do some liposuction and everything. But you're still leaving some fat behind just because there's a blood supply issue. She has the operation done, and then she loses more weight. In other words, going from 100 to down 200 more. That skin that I leave behind, it because of the weight that she has gained, doesn't have much elasticity to it. It's like basically an overblown balloon, okay? And all you're doing with this, even though you're making the balloon smaller in this case, if you take the air out of it and worse the fat out of it, things it won't go back the way it was originally, but still I think you're not getting the best results. You get the best results when you're down to where you want to be. You have the operation. You maintain your weight afterwards because you've gone through a lot of trouble to get where you're at. That's the best way to do it. Just be down to where you want to be. Most people will wait about 3 or 4 months to see if their weight is stabilized, and then they'll have the operation.
Is the procedure different for men and women?
No, it's the same. It's the same. The differences are that some people need to go all the way around, some people don't need to go all the way around. If they're hanging from the sides, like in that lady, in her flank regions, and again on her, I did a little buttock slip with that too, just because the skin that's and fat that's there above the buttocks, you can kind of put it a little bit lower to give them better projection, okay, and then bring tissue over the top of that, because the buttocks tends to be sagging, okay, you're just kind of bringing it up. But that's kind of the way that works, you know. You want to be where you want to be, and things can be stable for at least 3 months, some people up to 6 months, and then do the operations.
Talk to me about the pain. Is it real bad when you come out of surgery?
Well, the painful part is me tightening up muscle. It's kind of like a tummy tuck, you know. Some people you don't need to tighten the muscle. Most of them you do, because the intra-abdominal fat has stretched out the abdominal wall, which is the muscle. That's the sorest part. Taking off skin, it's sore, but you add on tightening muscle, and it increases it by a couple-fold.
Yeah.
But it feels like you've gone to the gym. You know, you did, I don't know, 20 or 40 sit-ups, wake up next day and say, I'll never do that again. Recovers the same way. First day sore, second day sore, third day sore, full stiffness. Fourth, fifth day is more of a stiffness than a soreness. Now, I do overcorrect on tightening muscles and overcorrect on tightening the skin, because my philosophy is as it heals, it tends to swell, it tends to loosen up things. And so you'll be walking bent over for about 3 or 4 days. Some people's back will hurt a little bit before they're able to stand up, but it's worth it. It's worth it.
You going to be out of work for a while?
Yes, probably a couple of weeks.
Okay.
Couple of weeks. I mean,
Well, it's something to plan for.
Yes, yes. I mean, it's a big operation. You know, tummy tucks are out for about a week or so, but I would plan on for at least a couple of weeks. You know, for a body lift.
Of the tummy lift, and then the arms and the thighs, where do you see the best results out of the 3?
The stomach.
Yeah.
Yeah, the middle things. I mean, the results of them, on all of them, are good. On the problem that people have with, and it's just a sacrifice, with doing the arms. I mean, you know, they don't like that kind of jiggling back and forth, but they have to put up with an incision site, which eventually fades. That's noticeable, can be noticeable, even though we try to put it down, out of sight, out of mind, and things. I mean, sometimes they have to be extended across the elbow. You know, majority of them, you know, don't mind that. Okay, but you know, there'll be some few complaints about it, but there's not much you can do about it. If you're going to do an arm and things, and they have a little pouch down here, you can try to liposuction it first, but again, it's a skin elasticity issue. Okay, if this has been overblown, you take the air out of it. You know, it's still kind of on that floppy side.
What about the risks of the procedure? I know all procedures have risks, and this is no different.
Well, you know, as a rule of thumb, the longer the surgery, the bigger risk. And the longest of those 3 surgeries is going to be your abdominal, you know, the body lift and the central portion. It'll take between 4 and 5 hours. Now, again, it's not, you know, I'm not operating on heart, lungs, intestines, things like that, you know. So basically, it is just skin and fat and tightening some muscles. But, you know, we put little boots on their legs. So biggest risk would be, you know, clots in the leg, which is very, very, very small to begin with. But, you know, even afterwards, they have to get up and move around. They want to stay well hydrated. Infection rate's real low. It's a clean case. I mean, I really haven't seen infections with it. Again, I don't like to do smokers, because they'll have, you know, some wound problems. You know, 20 or 30% of them, and that's it's more than a share of nuisances.
Now, if you're a smoker and you stop smoking, can you become a candidate, or because of your long history with it, it's still not going to make you a candidate? How's that work?
Off for 4 weeks, okay, and you know, staying off for 4 weeks after that. That puts you back into that candidate, being a candidate. There's still been some issues with the tissues left behind, but it you know, stopping things goes a long way as far as the healing. Because it's a blood supply issue. I mean, basically, you're undermined all the way up to the ribs, you know, and even in the back, and you're pulling all this extra skin off, and so you've got about a foot worth of, you know, good tissue and things that you're going to leave behind. It's just that all the blood supply now comes from here versus coming up through the muscles here, and that's a long ways. And so we need oxygen, and you know, you have these little blood vessels that are feeding this. But every time you smoke a cigarette, it really is like turning off the spigot when it comes to blood. Okay, and so if you don't have any blood supply going to that lower portion of the abdomen, that's where you're going to have, you know, wound problems and wound healing problems. Certainly not in all of them, but you really don't want to take that risk. You want to put those variables in your favor prior to having an operation like this. You know, because after the fact, it's a nuisance. You know, I mean, it heals, but it just takes a long time.
How popular of a procedure is this? Well, any of these?
Well, it's popular. Probably do a couple of them a month or so. I mean, it's not an everyday thing. I mean, it'd wear me out if I did them every day.
I bet.
Yeah. You know, but it's like, you know, tummy tucks, and again, they're having the body lifts because they really don't like that sweating, and they don't like the extra skin. They're always surprised at how small the waist can become, you know, once they've had it. You know, they're real happy people. You know,
yeah, because that's all of their hard work from losing that weight, and then you can't see it. So this is a good way to actually feel like, oh, look at what I did, and now I see. You've
lost that weight, but you still have these rolls that kind of hang out, and yeah, they're real happy about that. Getting that body lift. It's, you know, of all the operations, tummy tuck and body lifts really do help change men, but primarily women's, you know, whole outlook on things. I always say if you can get women back into clothes they haven't worn in a long time, they're very, very happy people.
Yeah. Oh, yeah. Us women, we love looking good in those jeans. Everybody has those pair of jeans that you want to get into.
Right.
And you still hold on to them. I've got this one pair that I'm just like, oh man.
Yeah.
I wish I could fit back in those. Let's go ahead and put up those graphics one more time, just because I want to show people again the difference between before and after. And if you would, Doctor, okay, so here it is. How long did it take for her to go from the left-hand side, from the before to the after side? Because obviously she's healed a little bit. So what stage are we looking at there?
She's actually probably about 3, maybe 4 weeks out. There certainly is, after this operation, some swelling, but it never can swell like the pre-ops. I mean, to that size. That shape is noticeable right after the operation, plus a little bit swelling on top of that.
So she went from, plus a little bit of swelling, but she basically went from the left side to looking like the right side. It was just a matter of healing the scars and that little bit of swelling?
Yes. I mean, that is, like I said, this is about 3, maybe 4 weeks out, maybe 6, I don't recall. So all of her bruising has resolved, and there's not much bruising to it. I mean, but where there's bruising, there tends to be a little bit more swelling. But yeah, that doesn't take much time at all. I mean, there's certainly a punk out factor to it. Like I say, it takes a couple of weeks to kind of get over that, but you certainly don't want to be laying around in bed and moping and all. But that's what pain medications are for, and instructions afterwards. Again, get up, move around.
Yeah, her stomach looks great. And then where was that incision line underneath? I guess you can kind of see it. It's pretty low.
I always make mine low.
So you're not really going to see it very often.
No, if you
it's very well hidden.
Wear normal pants, I try to stay within painted lines, just because that's what I like to do. But some people put it higher, but I just figure if you're going to do this, keep them as low as you can, because people can cover it up better.
Yeah, yeah. Now, do you get a lot of men who want this tummy tuck, the tummy lift?
Yeah, I do. It's not as frequent as women. Probably of the patient population that have, you know, some type of, you know, gastroplasty or something like that. You know, the majority of them tend to be women. So I will see more women than men.
Okay. What do women most commonly ask you about? What are some of their big concerns before they head into this?
Can you get rid of all those rolls? I mean, can you get rid of all that extra skin? And the answer to that really is, from one person to another person, yes on the abdomen, okay? On the flank regions, there's typically 2 rolls before you get to the flank. I mean, you'll notice it on normal people. You know, like a woman has a bra line, men have a bra line too, but we don't wear bras. It's where the skin is attached to the underlying muscle by about this much tissue. So, you know, women come in like if they're wearing a bra and it pushes this down and it tends going to hang over. The reason it's hang over because it can't slide down. Okay, there are actually 3 quote bra lines, or areas like a bra line, that goes from where the bra is all the way down to the hips. And you'll see it where basically they have a little bulge below their bra line things, then they have another little bulge, and then they'll have the flanks. In that case, if you can go up to that, if you're working the flank regions, you're making incisions low, you can go up to that first bulge, okay, and basically unravel it. After that point, you really want to hold off, because really that's where the blood supply is coming from. I'm taking away the blood supply in that lower portion at the flank regions. and I'm pulling that skin down so that any skin flap, okay, that comes from that the rolls above are supplied by the blood supply that goes to those rolls. And again, we need blood supply to heal. You don't want to mess that up because again, it would be more of a wound healing issue.
Any possible complications afterwards?
Now, the thing we have to look for primarily is, again, since there's not a lot of bleeding with this, post-operatively, you still want to, there'll be some drains, usually about four drains in. Make sure they don't have any bleeding underneath the skin afterwards. And that's why we wear this abdominal binder, puts pressure on things. But people have to move, and so, there can be a little bleeding underneath there. You just don't want a lot. Again, I've seen a couple of them in 25 years, and you have to take them back to the operating room, clean all that stuff out, because it takes a long time for it to go away. That's really the biggest complication I've seen. Really haven't seen any infections with it. I've seen some slow wound healing, there's no doubt, but it's not common, but it's, something you have to keep. But
it's something to think about.
Yep.
All right, well, we've got Laura on the line now. Laura, what's your question for the doctor?
My question is you were talking about the recovery on body lift and tummy tuck. What if you're diabetic? Is there a problem operating on a diabetic?
Yeah.
Type 2 diabetic.
Right. Type 2? So you're not using any insulin?
No insulin.
Okay. And how long have you been type 2 diabetic?
About a year and a half.
Okay. All right. If we're like 10 years out, even if we're type 2, the risk of wound healing, starts to go up. A year and a half is probably not that big of a deal. You still want to, afterwards, the issue we always got to look at basically is how to control the glucose levels. What happens is, because it's a trauma, your body will secrete some epinephrine. The response to epinephrine is to elevate your glucose levels. And so we just have to monitor those. People monitor them at home and things, so you just have to monitor that and go with adjusting appropriately. I haven't seen big problems with it. I really don't, type 1 diabetics scare me more than type 2 diabetics, because again, their actual small blood vessels have been compromised as far as the way blood flows into them, as well as the way oxygen flows out of the capillaries, because they're thicker.
Right.
Does that help?
Yes, it does. Thank you very much.
All right.
All right. Thank you so much for your call, Laura. All right. So how invasive is this procedure? You said that it's not that bad because it's just skin.
No, it's bad.
Oh, it is bad.
I
was going to say because it's not one of your organs, but it is covering a vast amount of area.
Okay. Well, yes. I mean, remember, your body doesn't look at the type of tissues. It looks at the volume of tissues being upon. I mean, the example I give is usually, let's say that somebody took out a chunk of fat that was, the size of a walnut, but they took a chunk of, of tissue of your brain that was the size of a walnut. Now, your body will look at both those areas and say, this is an area of trauma about the size of a walnut. You and I would have functional problems if we took out a portion of our brain.
Right.
We wouldn't have a functional problem when it comes to the abdomen. So, the main thing about it is it's a big operation, lots of trauma. Yes, not invasive from standpoint of intra-abdominal, organs and things, but it's still.
But it's a big deal.
Yeah, I mean it's a volume issue.
Gotcha.
Not the type of tissue. As far as the tummy tuck thing goes.
Okay, well that's something to think about too if you're considering all of this. If you were to leave people at home, because we just have a couple minutes left, with a final thought, what would you want people to get out of today?
Well, that basically, like I said, it's a good operation, but it's a big operation, so you and your family have to be prepared. It'll cramp your style just like any other operation, but a couple weeks, is what you'll have from it. You can go to my website. It's a new website actually, and see 2 other examples of body lifts, and you can comment on them. Right now, we're kind of running a special. Let people comment on things and help me out with the links and all. They get 20% off the injectables and office procedures.
Okay, what's that website?
Yeah, it's bridgestobeauty.com.
Okay, excellent. And then do you have a phone number for people to call?
Yeah, 318-218-4401. No, actually, that's the cell phone number. It's,
Hey,
it's 318-219-8555. But you can call a cell phone number too.
You know, either or.
Yeah.
All right.
Yeah.
Well, great. Well, thank you so much for being here. We do appreciate that. That's a lot of great information. And really, when you do all that hard work, you really want to see it pay off. So this is a way to really see it pay off.
Yeah.
All right. Well, thanks so much for being here. Thank you for joining us. We'll see you
pleasure.
right back here next time for our next edition of Healthline.